All this is Dr. Mobeen Sayed and Luffy over here. Luffy just came back from outside. He's making a lots of noise as well. Here he is. Let's start our discussion. I hope everybody is doing well. Luffy, would you not let me talk? Why not? What? I didn't say you anything. What happened, Luffy? Come, what happened? Did someone beat you up or something? So he actually came here, talked with me, and now he's going off. Okay. All right. So let's see. What are the questions here? Trillium Lane says, good presentation, complicated and messy. Yet it's an age group where neither do they have enough data, nor do they have good trial size. So those folks who say, well, the trial sizes are small for other drugs, and well, there is a lot of extrapolation, and people are making up data here and there. And look, there was a lot of extrapolation here as well. Skyfrog, I like your comment. Okay, so let's see if there is a question. Westfield says, hit the like 18 of you. Yes, now there are 58. And give me a good question as well. Colin says, I know I missed so many episodes that I'm likely to ask a few previously asked questions. But question, if someone got a vax in the vein through not aspirating, would it cross the blood-brain barrier? No, it will not cross the blood-brain barrier. I was smiling because this question is not the blood-brain barrier part, but the vein in the vein question is very common. There is a person who has been pushing it very much, but no, it will not go to blood-brain barrier. Chris Johnson says 5 years old. Yeah, so that is what FDA's panel just said. Siddhartha is here. Hello from New York. Hello, Siddhartha. How are you doing? Christine, question, can we trust data and studies done by companies that stand to profit in the billions? So I hope that, what? Luffy? Am I allowed to talk or not? He comes in, he says something, and he goes. So, Christine, I hope this is a rhetorical question. SD says, how long does the antibodies last after recovering from COVID? So, SD, I have done this discussion. I'm going to give you answer in multiple parts. First part with the COVID. And now you're talking about recovering from COVID. We saw with the long-term immunity, I did a studies discussion where the immunity or the memory cell can last for years. Antibodies continue till 4 months and then they wane. And it is a normal and natural and needed behavior. We do not want our immune system to identify an infection, start attacking it with the antibodies, and then for the rest of our life just keeps making antibodies. If that is the case, by the age like I am in, I would have made so many antibodies that are just continuously being made that I would have my blood as milkshake and not work at all. And that is multiple myeloma is kind of one outcome of that. So we don't want the antibodies to be there forever. So normally about 4 months after the after the infection or the antigen is gone, 4 months after the antibodies go down. That's normal and natural. They normally come back up when the re-exposure occurs. And they would then come back up very quickly within 1 or 2 days and make that thing a milder thing. For example, with the COVID, they will end up causing COVID to become a milder infection in the future in healthy individuals. So, good question. The other part of this is that the vaccine companies continue to say that, hey, the antibodies wane or the immunity wane, and that is not the best thing. No, immunity wanes. It happens. This is normal and natural. Maybe then if the vaccines are seeing some, or these companies are seeing some extraordinary waning, and the restart of the immune system is not there, then maybe they should look at their vaccine products to see why are they not behaving correctly as other antigens do. Then another part of this answer is that in the SARS-CoV-1, not 2, in the SARS-CoV-1, if you do a research on Google, you'll find so many studies where they saw that the antibodies would be produced or be available till 2 to 3 years, and the memory T cells will be available for 10 years and onwards. So this is a very good question. Melamorph says, can you explain the difference between how a child's immune system works versus adult immune response? So generally they are very similar, but here is a basic difference. I'm gonna draw. So give me 1 second. Share my screen. I was afraid it's going to flicker again. Somehow my screen has been flickering. So this is a good question. Basic most difference. So there can be many differences. For example, a child's immune system is going to be more active than an adult's because child's immune system is brand new. The whole body is brand new. So they make more cells. The cells are more active. They're more agile. They're more flexible. So that is one that just in general, child's immune system, healthy child's immune system is generally better than somebody who's an adult. That's one. So performs better. Secondly, interestingly, a child's innate arm is actually better than an adult, especially the natural killer cells are more in number and are in better performance. So that actually is one of the possible reasons why COVID is managed well by children. Thirdly, a child gets more infections than adults because of the school and getting cold and getting other infections from others. Their innate arm is more cross-trained. Cross-trained meaning, let's say they got the human coronavirus infection and then the actual COVID SARS-CoV-2 occurred and they handled it better as well. So that is cross-training. So training against one type of respiratory virus helping attack another type. Then again, they get more respiratory infections. So this is more respiratory infections based answer. Children get more respiratory infections. Because of that, they have more immune cells lining the respiratory system. So they handle respiratory infections better. So some of the differences. Patty Zig has a very good question. If a baby born to a mother who had natural COVID and full course vaccine, will baby inherit B memory cell and T cell from the mother? So no, they will not get the cells. But if mother is making IgGs, IgG can cross placenta and go to the baby and provide protection. Actually, after birth, for many months, baby are actually protecting themselves by the antibodies given by the mother. So they get the antibodies, but not the cells. Would baby have natural immunity? Would vax be necessary? So baby will not have natural immunity. There is no study so far that has shown mother passing virus to the baby. And then babies do not have a good immune system. So baby, we're talking about 6 months and earlier of age. They don't have a fully developed immune system. So they cannot actually develop very good responses. That is why they are banking on mother's anti-IgGs that have been passed on to them. So would they have natural immunity? No. Would vax be necessary? That is a different question. And even if you take a child who is lesser than 6 months of age and we try to give them vaccine or others, it may not be that they would develop a robust response right away. This is why in these studies, if you see the studies of COVID-19 around children, lesser than 1 year of age children are more at risk of severe disease compared to 1 to 9 years of age, because that is where the immunity has started developing. But lesser than 1 year of age, baby is still more vulnerable. So VM has a very good question as well. So, good thing now, today we have good questions. Can the vaccine activate the immune system in a person with autoimmune diseases? Yes, so that is what the vaccine does. Vaccine will activate the immune system. Immune system will present cytokines or the chemokines or those chemical factors. They may flare up some of the other autoimmune diseases as well. And hopefully, in theory, that should be less, that should be short lived, it should not be long lived. But again, you know that with the autoimmunity, you should talk with your doctor, your immunologist, to say, hey, I have this autoimmunity, I'm going to get the vaccine as well, let's see what happens. Do you know that many of the cool beans have reported that some of their autoimmune diseases became less severe after the vaccine? So that is an interesting, maybe their T regulatory cells, which then started to quell the inflammation after the vaccine, they, when they became active because of vaccines poking of them, maybe they were able to quell inflammation generally in the body. But some folks have said that. So Percival says, any thoughts on long haulers getting the vaccine? Your personal experience, how many get better versus how many get worse? So I'll use Dr. Yo's comment that he made a comment, and I'm trying to get Dr. Bruce Patterson with us again to give us the latest. So a few months ago, when I spoke with him, he said 20 to 30% of the long COVID with vaccine become better. Colin says, how effective is NSC against excessive mucus production? So it does not protect against excessive mucus, but it kind of dilutes it, and then it still needs to be removed. So mucus production is a different mechanism. NSC can help dilute, but I don't, it used to be used for that, but not much because there are better medications. Sarah, this is a very interesting question. My refill ivermectin has hardly any taste at all. The first RX had a medicinal, slightly bitter taste. Refill is Edinburgh. I have not heard of this. I don't know if it is. I'm hoping it is not fake one, but I didn't hear that. SK says, is SM102 in Moderna toxic? That's a good question. I don't even know what this substance does, so I'll have to research. Kelly says, thinking about cross-reactive immunity from previous human coronavirus infection, how much immunity could come from that? Just guessing, but similar to one dose of Pfizer. Crazy thought. So cross immunity within the child is actually good enough to protect them from COVID, for example. So that cross immunity can be very, very protective. Now, exact quantification I cannot tell you, but I can tell you that it helps children. Very good question, though. I was going to say that, hey, ask good questions and fast, and here Kelly had a good question. Um, Pam says, I have mast cell syndrome. Shouldn't I avoid vaccine? So, Pam, I cannot offer a personal answer for a personal thing. That is where you should talk with your doctor. Generally, there are many people with the mast cell syndromes as well, and they take vaccines, and it does not cause too much of an issue. But every person is a different case, and so I cannot offer you any medical advice. So that is correct. If it is CVS, it has to be legit. I don't think that CVS is going to do anything incorrect, although they're not refilling them anymore. So that is incorrect. But meaning selling us fake medicine. I don't think that would happen. So Kira Shram says, how sustainable or not is this as long-term safety strategy using intranasal spray that kill virus in the nose like sanitize, which was found effective? So their own message was, and we talked about sanitize, their own message was keep it with you, and as soon as you suspect you may have an exposure, spray it. So I think that is a good thing always to be able to imagine that is part of hygiene. So that is good. So Joe N says, could you please explain COVID disease and possible system damage in context of severity of symptomatic versus asymptomatic versus mild cases, vaccinated children? That is like talking about the COVID for 18 months that we've been doing. I'll give you a general idea because this is a very large topic. So let's start. Could you please explain COVID disease and possible system damage? Context is severity, symptomatic. So let's say asymptomatic, symptomatic mildly, then severe, of course, are symptomatic. These are all symptomatic, and then even to the point of then death, right? And then long COVID. Long COVID. Asymptomatic simply means they don't have symptoms. So not having symptoms means that there is not sufficient tissue damage to cause symptoms. For example, if my lungs are damaged, I will have some symptoms of breathlessness or difficulty in breathing or sputum or other issues. Similarly, if my throat is damaged, I would have scratchy throat or cough and things like that. So asymptomatic means there was infection, but there is not enough damage, and immune system took care of the problem before the damage could occur. Asymptomatic can become long COVID. So that is an interesting thing. So that's one part of your answers. Symptomatic, mild, for example, possible system damage in context of severity. So of course, in asymptomatic, we are saying possible no symptom, no system damage, but because it can become long COVID, that means still some way of disorganizing or causing disruption of the immune system. Maybe the S1 protein, like Bruce Patterson's team says, S1 protein hanging out in the monocyte, maybe some other reason that immune system is not balanced. So they don't get the throat symptoms of cough or nasal symptoms or respiratory symptoms, but they get immune system's behavior, which or misbehavior, which may not be right away detectable, but would convert into long COVID. So that is actually a problem, a disease. Symptom may not be apparent right away. So that is possible with asymptomatic. And of course, now the damage was originally the immune system damage, and then immune system is causing damage in other parts of the body. Symptomatic mild disease. So symptomatic mild disease, so many symptoms, hundreds of symptoms, right? So it depends where the symptom is and what is the damage from that. For example, if you start from the top down, there are symptoms of dizziness, and there are symptoms of neurological issues. There is tinnitus, there is burning of the eyes, there is pain in the eye, there is pain in one eye, there is blurry vision, there is irritation in the eyes. If you go down nose, there is anosmia, there was no runny nose, but nowadays with Delta there can be runny nose as well. If you go down, and runny nose mean damage in the nasopharyngeal area. Whenever there is more secretion coming out, that means from any place, that means that blood over there, blood pressure is increased, the blood vessels are inflamed, they are swollen, and more fluids are coming out. And they're coming out because there is local damage nearby, and those inflammatory particles or substances cause the blood vessels not only to swell up or dilate, but their holes, the intracellular junctions, they increase in size, the junctions. And so there is more, if I can, there are more open junctions in the blood vessels through which fluids can come out, and those would cause congestion in the local area, the local areas will be filled with water, right? So, so that is a symptom in the runny nose, congestion of the throat, congestion plus inflammation plus damage to the throat would cause scratch in the throat and cough and things like that. If you go down, if you go to the frontal route here, or the route in the front, that is respiratory system. So of course we know that there would be respiratory outcome, and we saw that the symptoms of the respiratory system first start as an atypical pneumonia. Atypical pneumonia means that a person is not actually aware their lungs are getting damaged. So let's say this is an alveolus, this is another alveolus. Between the alveolus, this is another alveolus, and so on. These are the air exchanging systems. Between them is the connective tissue and blood vessels here, blood vessels going here as well. And so there is exchange of gases. And what happens is, first there is atypical pneumonia. Atypical pneumonia means there is the infection of the interstitium of the lung, or the connective tissue of the lung, or the outside of the respiratory units. There is infection, which causes the person not to actually feel much, but their oxygenation may still be disrupted because the respiratory barrier is damaged. And so they, if you see their oxygenation, the oxygen levels will be dropping, but they would not say anything. They say, I'm fine. And that is atypical. But COVID-19, normally viruses cause atypical and then they recover. But in case of COVID-19, it is such a disrupting, such a bad, evil virus. And I know some people are now going to put the comment that, why did you call it an evil virus? God made it as well. And so, well, it is to us evil. It is made or not, in whichever way, but it is killing people, and anything that is killing people is evil. So, without reason. So here, the virus, this is such a bad virus that it causes so much damage to the respiratory system that eventually it becomes typical pneumonia. And typical pneumonia means that pneumonia, or the inflammation inside the alveoli. And now the damage has started occurring inside. The type 1 pneumocytes are damaged, and type 2 pneumocytes are damaged. And there are macrophages sitting here, and the neutrophils sitting here, and the local congestion occurring. The result of all of that is that this airway is now filling with this junk and trash because of the broken cells and the inflammatory markers and all of those things. So this becomes typical pneumonia. Now the patient is going to start having cough, and they would have sputum, and they would feel the difficulty in breathing, and they'll have pain in their chest, and all of those things would start appearing. Then what would happen is, ideally, there are multiple answers here. It is possible that this resolves. Resolves means that all of this is cleared out, which happens to most of us. When we get respiratory infection, the alveoli fill up with these things, and then that whole thing is cleared out. That infective material is gone. So that is called resolution. So if resolution occurs, the chest goes back to normal, almost normal. But sometimes organization occurs. Organization means that the trash that has been there, this trash, it gets calcium deposited in it. And calcium has a behavior in our body that wherever there is inflammation, calcium makes an appearance there. And the calcium's role is, calcium's wish is that wherever there is an inflamed cell, wherever there is damaged cell, calcium is going to jump into that cell and fill it with calcium, cement, and kind of fill that gap. The role of the calcium is, just like if I, let's say, break part of this cupboard over here, and there is a hole, somebody has to come and fill that hole. Calcium is the one that fills the holes in our body's damaged tissues. Then scarring occurs as well. So if the calcium starts depositing here, that is calcification starting occurring, then the proteins are depositing. These are the broken cells and the cytokines and those things. So amyloidosis is occurring. And then on top of that, the scarring starts occurring. Then that is organization. Now this part of the lung is gone forever. Not only that would happen, but what would happen is that this lung would now develop. So let's say this was a normal lung. So you have started a discussion that can continue for days now. So I'm going to try to be brief. So this is the lung now, right? So this lung has gotten damage to it. This damage, if it is not resolved and it is organized, then the scarring would occur. And you know that the behavior of a scar is to pull the tissues inwards and contract. And when it contracts, the lung surfaces are going to become less in size. This is called baby lung physiology. And many people who get severe lung damage, they end up with the baby lungs. And because of that, for the rest of their life, they are not able to handle the oxygen needs of their body. They may be on oxygen forever. They will need a lot of rehabilitation, lots of physiotherapy, plus a continuous availability of oxygen, depending upon the severity of the damage. So that is just some damage in the lungs. There can be blood vessels that would break. There can be embolism that can happen. So there are lots. There can be bleeding that can happen. There can be collapse of the lung. There can be lungs outside surfaces that can become infected as well. But most of the time with the COVID, resolved pneumonia, atypical to typical, then resolved. But in some people, atypical to typical to ARDS, acute respiratory distress syndrome, to either death or very severely damaged lungs forever. Then, so continuing, inside here in the chest is also heart. So we know that COVID can attack heart as well and cause cardiac inflammation. So that is another. So you have seen that patient can have tachycardias, patients can have difficulty with the cardiac outputs. So cardiac damage can occur. In the same area in the chest, there is also GIT. So esophagus is going from here. So gastritis. So 4% of the cases would develop gastritis or gastroenteritis. And what is that? Is that the COVID would cause inflammation of the stomach and the intestine. And many times people tell me that, hey, COVID will be destroyed by gastric acids because it is an enveloped virus. And this is true that enveloped viruses. So let's say this is stomach and there is an enveloped virus. Enveloped virus simply means it's a virus that has stolen our cell membranes layer, and it has that layer. It has a layer that is delicate skin. So the stomach acids usually digest that skin and destroy it. So most of the enveloped viruses cannot survive stomach acids. That's correct. But COVID is such a, not COVID, SARS-CoV-2, even SARS-CoV-1 or coronaviruses, they're such smart cookies that they have, I called them evil a few minutes ago, I know. So they have this spike protein on surrounding them, and that creates such a fur-like structure around them, such a thick structure around them, which protects them from the attack by the acids. So they can actually not only be protected in this environment, they can actually cause infection of the stomach and then infection of the GIT, other elements, and causing gastroenteritis. And we also know for SARS-CoV-2 that it can sit in the GIT cells. So these are the cells of the GIT. I've straightened up. So if somebody is a medico over here, they would say, what the heck? Mubin just made a straight tube. Yeah, so I know that there is duodenum and duodenum and ileum and colon and ascending and transverse and descending and sigmoid and rectum. So I know the parts, but I'm just going to illustrate them straight. So COVID, we have seen, can actually be present in the GIT cells, surface cell, epithelial cells, for months afterwards, which would cause inflammation of the GIT, which would cause lots of gastritis and lots of GIT issues and lots of diarrhea and nausea and such things. And there will be diarrhea would occur because there is going to be, number one, less absorption, and number two, more secretion. So that is on the GIT side. Then if you go for pancreas, COVID can actually cause pancreatitis, which can result in diabetes immediate or diabetes later on. Then if you look at the vascular system, the most important pathology is that COVID can, so it doesn't really directly damage the blood vessel. What it does is this. So let's say this is a blood vessel. Blood vessel's internal surface is endothelium. Endothelium of the blood vessel has, what have you started, Joanne? You have started a button on me, so maybe I should stop. So here is an endothelial cell. This endothelial cell has ACE enzyme and it has ACE2 enzyme, correct? And the ACE2 is responsible for, so ACE enzyme or ACE1 is responsible to convert angiotensin 1 to angiotensin 2, and ACE2 is responsible to convert angiotensin 2's breakdowns into further smaller breakdowns. So one is pro-inflammatory and the other one is anti-inflammatory. So ACE1 is pro-inflammatory, ACE2 is anti-inflammatory. So if you damage anti-inflammatory part of the cell by occupying that or by down regulating it or by damaging it, then what happens is that pro-inflammatory side starts winning and the blood vessel starts getting inflamed because its balancing mechanism is destroyed. And because of that, now the inflammation would occur, that would cause the local damage, that would start clotting in there, that would start disruption of the endothelium, that would cause congestion. So lots of cardiovascular things that we see and the clotting things that we see, they appear because of this damage. Platelet activation occurs, clotting occurs. Then, depending upon how severe the disease is, those people who die, we know that the coronavirus is seen in their privileged sites. For example, it is seen in the brain where it is not supposed to go, or in the testes or the ovaries or the liver or the other places. So normally COVID would not break the barriers and people would recover and they'll be fine. But in some people, it would break the barriers. Infection would just be so overwhelming that body's barriers would start breaking down in general because of all the infection and the metabolic dysregulations and the immune system dysregulations. And so COVID would then just go in the other places too. In addition to this, COVID can cause with the vascular disease. So it is interesting that COVID causes normally vascular diseases. This is like my medical test that, hey, Mubin, do you know medicine or not? Normally, vascular diseases are large vessel diseases, mid-sized vessel diseases, and then small vessel diseases or vasculitises, right? COVID does vasculitis of all types. So because of this, we see the cardiac side that has an issue. We see the respiratory system that has an issue. We see general clotting occurring anywhere. We see strokes. And then if you continue to go to the smaller vessels, the COVID toes are an example of small vessel vasculitis. So it kind of causes COVID toes, it causes stroke, it can cause cardiac issues, and it can cause other tissue damages as well. Again, it depends if we are able to catch those and fix them. Otherwise, these might become permanent damages or the person even may die. So these are some of the pathologies. Of course, if you talk with a few doctors, I forgot his name, he was with me as well, that there will be dysregulation of the histamine system, and there will be lots of histamine release, and there will be mast cell activation syndrome, and there will be macrophage activation syndrome. There would be immune system dysregulation. That in itself is a totally different problem that can linger on for a very long time with the patient, becoming long COVID, or unmasking the mast cells activation syndrome and now throwing the patient into a long living mast cell activation syndrome issue that they were not aware of before. So lots of pathologies. I don't know what was going on here, but I was just going on. I hope I didn't lose you guys. um, so let's see. Just going to quickly see. I see some super chats, but I do not see their questions. So if there were some questions with the super chat, my apologies. I was going through this. Please ask your question again. I'm going to go to the latest and see if I can answer. Joanne says, thank you for the explanation. You're very welcome. This was just part of it. John B says, that was awesome. Thank you. I thought I just went on a Bob FWD says long term side effects on Regeneron possible. In general, no. And let me explain why I thought about it. Um, Antibodies in our body, when these are generated, so this is, let's say, an antibody. When an antibody is generated, it has a bunch of things to do and outcomes. For example, an antibody can be generated and then very innocently it can go and get attached to our tissue, thinking this is the damaging, this is the pattern that it needs to attack. And that is an autoimmune disease, correct? And now there is going to be inflammation. When an antibody attaches somewhere, it causes, just like a big spaceship that is flying in the movies, and then it docks and there are some things open up on the spaceship. So when the antibody docks with the tissue, the there are areas that open up, conformational changes that occur, which cause complement activation. So it is funny that Joanne made me an internal medicine doctor, and all of a sudden, Bob is making me an immunologist. So let's say the complement system becomes active. When the complement system becomes active, that complement system would cause inflammatory outcome, and this local, plus it would create, it's so funny in our body when the complement system becomes active, it finally creates a cluster of proteins that look like a tiny weapon in the form of a pipe. And imagine there is a hollow pipe, and you take that and you thrust that through a wall. Now it is not only going to cause a puncture in the wall, but because it itself is hollow, it would create a gap in the wall as well, through which things can come in and go out. So when complement becomes active and settles on the surface of some tissue or bacteria or virus or fungus, it would cause a local um, damage, and that would cause a tissue to start spilling out its guts through this complement thing, and the cell would start dying. So one of the outcome of the antibody production is that if it settles in the incorrect place, it might actually cause local tissue damage. That is what happens when, so let's say somebody gets COVID and there are inflammation everywhere. What is happening? Antibodies are one part of it. There could be other reasons too for damage. I mean, there's a huge science for how the damage, that is medicine. Then this is also possible that when an antibody complexes with the antigen, so for example, Regeneron is given or any other antibody, and that complexes with the antigen, let's say the spike protein of the SARS-CoV-2, these complexes need to be removed, but they can sometimes get settled on kidney or some other places and they can cause local damage there. Wherever antibody would land, it can start inflammation over there. Now that should not scare us, because antibodies are doing this all the time and our body knows how to clear them. Our body has macrophages and other things that would come, pick up the antibodies, destroy them, and finish them. Similarly, the ones that are settling anywhere, they would be picked up by macrophages. Macrophages have a sweet tooth for antibodies. So it's not that now you should be scared and saying, oh man, antibodies are doing something wrong, I don't want them. No, they are in us working all the time. Our body is very sophisticated and managed and disciplined about these things. So this is another possibility with the antibody. Then um, antibody can, usually normal behavior is it would combine with the antigen and will be picked up by macrophages and be destroyed. So now if I go back to this, can there be long-term side effect? Ideally, no. The only time when antibodies may cause long-term side effects is when we produce antibodies against our own tissue and we don't stop producing them. That is autoimmune disease. Then it's not the antibody causing long-term side effect, but it is the continuous production of antibody, and which is going and attacking maybe our joint or our kidney or our pancreas or other pieces of our body and destroying them again and again. So now this, I do not, I'm not answering the part here that can there be chemicals within the Regeneron that can cause separate damage, but I'm just talking about the antibody itself should not be able to do a long-term damage. Okay, so I'm looking for more questions. So Denise says, I was aware of my MCAS, mast cell activation syndrome, prior, but oh my, did it get much worse post COVID? 20 months later, it's finally coming down with correct protocol, including Luffy. Luffy is so good, but good that you are now calming down. Sorry that you had it. Ia says, is lufimectin okay during vaccination? Yes. And I have done this discussion. It may be on the Odyssey. That one discussion is taken down. YouTube kind of scrubbed it. I see so many other folks who still have lufimectin talks up. Mine were somehow a no-no. Madame Modima Rose says, you're fine. Thank you very much. Um, BH says, Doctor, can you please do a video on mechanism of action of enzymes that lab studies show can eat the spike protein, that is bromelain, could help prophylaxis? We have done some of those discussions with bromhexine and camostat mesylate, but I can do this one too. Queen Citydom says, could IVIG or monoclonals help with neuro vaccine induced issues? No, unfortunately. Monoclonal antibody, let's not talk about IVIG for a second. Monoclonal antibody needs a target, and the target has to be spike protein. If the issues are because of the spike protein, then yes, it would work. But if there is no spike protein and it is the inflammatory system or immune system that has become dysregulated, then monoclonal is going to do nothing. IVIG, on the other hand, has its benefit because IVIG deficiency could cause immune system's dysregulation, and providing the IVIG can start helping it be balanced again. Now, neuro vaccine related issues. I was surprised a few weeks ago. One of my family members, she developed after one of the vaccines, she developed severe neurological symptoms. And she became okay with Luffy for a month or so, and then it relapsed. And then Luffy would not do anything to her. And finally, her doctor gave her naltrexone, and she became. Yesterday, she called me and she said, I am almost 100%. That was like magic. I was surprised that naltrexone had that effect. So, Kelly, I have always used IVM in 0.15 to 0.2 milligram per kilogram body weight, and maybe once or twice a week. But this is not an advice for anyone, please. Lisa, thank you very much. It's not only this, you do not know the extent of bans on me at this time. I'm going through some of these things and I cannot discuss them, but at some point I'll tell you the amount of bans for what can I say and what I cannot, you would not even imagine. It's beyond YouTube. Guy has a very interesting question. Is gastric mucus the same as mucus found in respiratory system during infection? Like a storage bin in case receptors have to be blocked or no, so they're different. um, Again, mucus is mucus, but the compositions of mucus are different based on what are the source of the cells, what is the local environment of that, and is this a normal physiological mucus, or is that because of pathological outcomes? Gift says you can tell his true passion is really art and Luffy. Mechanisms. This is why, as much as I have not confronted many of these folks, like I would not name them because that would make some people upset. I've not confronted them, or as some folks wanted, debated them. But because I'm crazy for mechanisms, to me it is so interesting to just look at somebody's statement and understand that there are so many gaps in the mechanism. Interestingly, it seems to me, and maybe I'm wrong. Sky Frog says, "You look so happy when you draw." Yes, I do. Interestingly, it seems to me that I am one of the most suppressed at this time or censored. Not, and please remember, it's not just YouTube just gets up in the middle of the night and says, "We're going to suppress and censor Mubin." There are people behind this. Okay. Luffy mechanisms are squirrels. Okay, what else? Good questions. Um, Art Patron says, "Is ethics of vaccine segregation and apartheid the ultimate caste system to create new social class of filthy untouchables and justify cool bigotry and ignorance?" Says, okay, so you have set up a context in which it is difficult for me to uh, talk more, but I'm gonna share something um, which would once again get me in trouble. So, guys, you get me in trouble, and then I am left to fend myself from all these things. And it takes me lots of stresses to do it. But check this out. Here is a person. Let's take that as me. Let's not use anyone else as an example. Let's say this is me. And this is me. Okay. Am I looking handsome or something? So, this is me, and I am fully vaccinated as I am, right? Now, the question is, I am fully vaccinated. What is the point of me being fully vaccinated? The point of me being fully vaccinated is that if the virus occurs or comes near me, I have better outcomes. And what are the outcomes? You are seeing this again and again, that there is no guarantee against infection, getting infected. Again, I'm not putting any conjectures here. I'm talking uh, data that infection, there is no guarantee that infection will not occur after the vaccination, correct? We all know that. And we're seeing that. Even Pfizer, like folks are saying, hey, our antibodies are waning, people are getting infected, give them boosters. However, there is a better probability that hospitalization will not occur or will be less in number, and COVID caused death will be prevented, correct? But this assumes that if I get infected, I'm given a vaccine to say if you get infected, you have better outcomes. I totally agree that if this person has comorbidities and they are at risk even after the vaccine, for such person to bring them in close proximity to the virus, may that person be a vaccinated person or unvaccinated person, who might bring a virus to, let's say, somebody who's sick or who's ill and who's bedridden or who has cancers or who has uncontrolled diabetes or has other such issues, and they are vaccinated too, we have to protect them. So vaccines offer less protection there. But if it is not that way, then isn't the basic idea of the vaccine to say, well, Mubin, if you come in contact with the virus, and that may be another person who may be vaccinated but can shed, or that may be a person who is not vaccinated, or that can be some other uh, mechanism of getting exposed to the virus. Maybe this person is a doctor and goes in a hospital and works. So the point of vaccination is to provide support. My my why do we then tell people to say you must not come in contact with Mubin if you're not vaccinated, and we would only believe that you're okay if you are vaccinated? Well, the thing is this, that vaccinated person should be, in general, that's the point, be protected. And if they are not protected, again, I'm talking about healthy, I'm not talking about unhealthy folks or ill folks or have comorbidities which even after the vaccine puts them at risk. In that case, such a person can have risk because of a vaccinated person coming near them, or unvaccinated because a vaccinated may have picked up an infection as well and may be shedding too. So that would be a general case for everyone. So that means vaccinated folks, I don't think, should, you know what I'm saying, right? They should not be saying now everybody around me should not be shedding. But at the same time, now let me go to the flip side. It kind of makes sense as well to request everyone to be vaccinated that can be vaccinated, so that the virus is eradicated and it becomes more of a nuisance, a common cold like thing, as fast as can be, and so on. But the point of vaccination is, hey, you are protected now. And so then why to be too worried? Okay. Skyfrog says, be careful what you say, don't get in trouble. Yes. So I try to control as much as I can. Okay, so what else? Alquin says, orange bean bad. Um, Gift says, why is Dr. Bean orange? Like powerful. Orange is powerful. All right. Texas has said bye. I think it is about 8 o'clock. Even a tough topics video once a week. Yeah, I think I should do something like that too. So how about we let's take this as a last question. So Melamorph says, would 2 doses of vaccine affect or cancel memory B T cells from previous COVID infection? No. Would it be possible to stop having more vaccines if B T cells are not affected? No. So no, B and T cells would just do their function. They would even increase in number, but they will not be destroyed. Vaccines can't do that. Vaccines actually have an adjuvants in them that trigger the immune system and increase the behavior and function of it. Okay, so this is where we are at for today. Um, Hopefully, Texas is going to talk about vagus nerve. Very good, enjoy. It's a beautiful nerve. Okay, to let go says, can we see Luffy? So Luffy was making noise, and my wife just let him out. So I'll I'll have him with me tomorrow. Let me just very quickly see if he's here. Luffy. Okay, so he was not out, he was inside. So here is Luffy, but he's grumpy. He's not super happy at the moment. Okay, Luffy, you can go. Okay, so here is Luffy, and here we are, and Luffy in the lose, yes. So thank you very much for the day. Imagine I said all those uh, rhetorical things I say at the end of the videos, and I would see you tomorrow. Bye bye for now.